Nearly every minute of every day, a woman dies during pregnancy or childbirth. These deaths disproportionately affect the most vulnerable women and children in the poorest countries.
We've even started a signature program called Mothers Matter. And the reason we've done this is, when you understand the statistics and the challenge that basically almost every minute a woman dies around the globe from these complications, and yet we know some of the answers and we know the interventions that work. And so we want to employ more of those interventions around the globe in broader ways than we have so far to really save women's lives.
By working with a global coalition of public and private partners, CARE will make pregnancy and delivery safer for 30 million women in Africa, Asia and Latin America by 2015. In the southern highlands of Peru, maternal deaths have fallen dramatically.
We really went in there and worked with the community, and there was significant reduction in maternal mortality, almost 50% in approximately 3 years. Really extraordinary statistics. But what really made that story powerful is that we also worked with the health minister and helped the communities work with the health minister to adopt those interventions as the policy of that region. And then we helped them take it to nearby regions and help them take it across the country.
CARE worked to ensure health centres were attended by skilled staff who spoke the local language. Cultural preferences like giving birth standing up were respected. CARE has also had great success working with the Peruvian Ministry of Health to create guidelines for emergency obstetrics and a citizens monitoring programme.
About 47 women volunteers were selected as monitors, and what they would do is they would be trained by CARE in order to be able to monitor health care services both in clinics and in rural health posts, and at all levels that they were able to get to. It held government officials accountable for delivering quality healthcare services to the community and really helped the community engage with their healthcare providers and helping them realize that they too are part of the health system within their community. So it was very empowering.
After years of conflict, Sierra Leone is one of the most dangerous places in the world to deliver a baby. 1 in 7 women die during childbirth. Most villages are far from medical facilities and trained birth attendants are scarce. CARE, in partnership with Marie Stopes International, is providing maternal health and family planning to some of the most remote areas of the country through a network of 12 clinics and outreach teams.
Some of the women are living in a very hard-to-go areas. The roads are so rough, they are not motorable. So they find it very, very difficult to come to attend the clinics. We do outreach activities to meet them, encourage them so that they come and deliver in the clinic and even to come and attend clinics.
She's having contractions. She's having contraction. She will deliver today.
CARE supports birth waiting homes with skilled attendants for women about to give birth. They are located closer to hospitals, so in an emergency women can receive immediate services.
There are not been any maternal deaths here because we take prompt action. We send for the ambulance to come and take them to Koinadu, to Kabbalah.
CARE also runs an income generating scheme, the Village Savings and Loans Project, where the community saves money into a fund that can be used to transport a woman to hospital in the case of an emergency during pregnancy or delivery.
This group, we all know this thing.
I'm very happy. This project has helped a lot. Before we had the scheme, women lost their lives. If it wasn't for this project, I would have died.
What we're really talking about here is simple, low-cost interventions that really can be utilized in all parts of the world. And so I think the power of this is that really, this is really possible, and I've seen it personally in communities in rural Sierra Leone. When I went to see them in their community, they showed me their chart that showed for 2 years straight they've had 0 maternal deaths in their community. And the tribal leaders and the folks who were running the birth house and clinic, they were so proud of their accomplishments, and that's in a very rural, remote community outside of Kabbalah in Sierra Leone. And so knowing that it can work there, you know that it can work in so many places around the globe.